Well, we're back right here on Hala Kuwait, and I hope everyone out there is enjoying their evening. We have with us right now our first guest right here in the studio. We have with us Dr. Kaushik Majumdar, who is a specialist in the Department of Pathology. Doctor, welcome to our program, Hala Kuwait.
Thank you so much. Thanks for inviting me over here. I'm glad to be here.
Nice to have you with us. So maybe, Doctor, we can start out by telling our audience a little bit about your area of work and field of specialization, please.
Yes. Actually, I am a doctor of surgical pathology and cytology. So I am the person who deals with that field of medical science which deals with diagnosis of diseases in human material, and we diagnose that under the microscope. So that is my main area of work, and broadly we receive samples from the small biopsy, which we call the human material in the form of small tissue, or suppose a tumor has been removed. So broadly, this kind of material what we receive.
So tell us, doctor, how do you deal with biopsy samples? How do you diagnose diseases from biopsy samples, sir?
Yes. So suppose small biopsy samples, tiny biopsy samples, what happens, suppose somebody is having a kidney disease, a liver disease, or a lung disease. A small biopsy sample is received and we try to diagnose the disease under the microscope. The main aim is to suggest the treatment guidelines. So what happens is, once we receive the sample, once the sample is out of the human body, it tends to die immediately, and once the sample suffers death, the integrity is lost. Once the integrity is lost, it is impossible to interpret anything. So we use certain series of fixatives for which the integrity is preserved even if the tissue is dead. So after that, some series of fixatives, some series of processing, and some series of staining which gives some colors and shades which we see under the microscope to give a diagnosis.
So what is the utility of your work as a doctor to the patients, sir?
Yes, so that is the most crucial question. So what we actually do is, once we deliver a diagnosis, the treating physician understands the disease condition in particular, in specific. So for the treating physicians, it is then comfortable for him or her to suggest or formulate the treatment guidelines. So based on our specific diagnosis under the microscope, the treating physician formulates or thinks the treatment guidelines which is beneficial for the patient.
Excellent. So liver and gastrointestinal pathology are your main fields of interest.
Exactly.
What are the common liver diseases that you experience in your practice? What do you see most common?
Yes, there are various.
It's very vast.
Yeah, it's a very vast spectrum of liver diseases. So broadly, if we can say, what are the liver diseases we encounter in adults,
yes,
and what are the liver diseases we encounter
break
in children?
it down like that.
Yes. So suppose the adults, we see the fatty liver diseases. Sometimes we see that there is bile accumulation in the liver. And sometimes we see certain autoimmune liver diseases because of some immunological conditions. Some liver diseases happens. Suppose certain diseases of the liver are drug induced. Drug induced in the sense, suppose what we mean in medicine is medicines. The medicine is, suppose the person is taking medicine and that medicine is creating an effect in the liver. So that is also a cause of the liver disease. And on top of that, there are certain pediatric liver diseases, children liver diseases. In the children liver diseases, it can be infective etiology, the infective causes. And on top of that, there are certain impairment of bile drainage. So the bile accumulates in the liver. Bile synthesis, the liver produces bile, but suppose the bile is not coming out of the liver. So that problem happens in children. And on top of that, infective liver diseases happen both in children and adults. So among the infective, the hepatitis group of disorders. So these are the spectrum of liver disorders which we get in general practice.
So doctor, how do you differentiate those diseases under the microscope? Explain to our audience about that.
Exactly. So what happens is, as I have told, we see different colors, different shades under the microscopes. So based on the architecture, what we see under the microscope, we try to pinpoint and specify what type of liver disorders is happening, and based on that we convey the treating physician that this particular liver disorder is happening to this patient to suggest the treatment guidelines. Based on that particular diagnosis, the treatment starts. So the more important is, under the microscope we delineate colors, shades, architecture to suggest a particular pattern of liver disorders.
So what are the causes of liver disease, doctor?
Yes, there are several causes.
Tell us.
Among the several causes, other than excessive drinking, there are several other causes, like there can be genetic causes of liver disorders. Certain liver disorders are genetic, inborn. Certain liver disorders happen because of the infections, like viral hepatitis. Certain liver disorders happen because of the immunological conditions. Certain liver disorders happen because of the bile accumulation. And mostly in children, the infective causes, and there is accumulation of bile. These are the predominant liver disorders we encounter in our clinical practice.
How is obesity related to liver disease? Because we have a high rate of obesity per capita in the state of Kuwait.
Exactly.
So explain in detail about that, sir.
Exactly. That is the most crucial question maybe of this evening, because the obesity and liver disorders, one of the predominant liver disorders which we encounter in our clinical practice is accumulation of fat, what we call the fatty liver disorder. So obesity is one of the leading causes of fatty liver disorder. So suppose obesity and its interrelated conditions like diabetes, like high lipid in the blood, which we understand by the lipid profile. When these things get deranged, especially the obesity and its related conditions, there is accumulation of fat droplets within the liver cells. And when the fat droplets accumulate within the liver cells, gradually the liver cells tend to die. Once these liver cells tend to die, what happens is those cells are replaced by a kind of healing tissue, and that healing tissue, more it is deposited, a kind of condition called cirrhosis develops, which gives a nodular appearance in the liver. And if it progresses continuously, so what will happen is there is a chance of liver cancer. So obesity is one of the alarming situations which has to be taken seriously, so that the liver damage can be prevented.
So can liver disease be prevented?
Yes, definitely.
Tell us what the audience, the people can do, sir.
Exactly. So it will be extremely beneficial, and it will be a success if the viewers can benefit from this discussion.
Yes, please.
Exactly. So the liver disorders prevention, there are, depending upon the cause, suppose there is infiltration or accumulation of fat within the liver. Okay, so leading cause of accumulation of fat is this obesity and its related conditions, diabetes and lipid in blood. So these can be prevented by lifestyle modifications, diet and exercise. So if the person can maintain his or her lifestyle, proper exercise, proper diet, and stay healthy, prevent obesity, prevention of obesity by itself can create a diminution of the liver disorders, can reduce the liver disorders substantially. On the other hand, a big cause is infective liver disorders. So again, good lifestyle practices can help to prevent. Proper food hygiene, proper hygienic practices can prevent infection, and if infection can be prevented, infective liver disorders can be prevented. But yes, there are certain conditions which are genetic. Genetic liver disorders unfortunately can't be prevented, but those can be prevented are fatty liver disorders and infective liver disorders.
So tell us now, what is the role of the patients now with liver disease?
Yes.
What should they do?
Exactly. So what happens is, patients, when the liver disease is diagnosed, initially they will feel a kind of weakness. They will feel lethargy. They will not feel like eating nicely. They may feel jaundice. They may have the yellowing of skin, yellowing of eyes. In those kind of conditions, they immediately should visit the doctor, get the test done. And once the tests and scans done, a kind of liver disorders can be suspected. A liver biopsy can be done. Once a liver biopsy can be done, it is examined under the microscope, a disease can be diagnosed, and then it can be treated, and further damage can be prevented. Further damage can be prevented. So suppose, on other hand, suppose a disease is diagnosed, treatment is started, then follow-up is important, and follow-up biopsies can be done to see the response to the treatment.
Yes, so that's some very important information. Do you have any other bit of advice for the audience watching right now, or other information that you would like to close with this evening, Doctor, on our program?
Exactly. So first and foremost, I am very happy to be here, and I must say to the audience, to the viewers of this evening, please maintain good lifestyle practices, proper diet, proper exercise, maintain your body weight, maintain your physique, so that obesity can be diminished. Good lifestyle practices can reduce infection. So if infection and obesity can be reduced, we can deal with the liver diseases very nicely. A broad spectrum of liver diseases can be diminished.
Very well said, Doctor, and we'd like to thank you so much for your time with us this evening right here on Hala Kuwait. Thank you, sir.
Thank you so much. It's glad to be here, present, and nice interaction.
Thank you, sir. We'd like to thank Dr. Kaushik Majumdar, Specialist, Department of Pathology, for his time with us right here on Hala Kuwait. Right now, we're going to move on to another one of our amazing reports, so stay tuned for this.